Hello, I'm Alexandria Almeida and welcome back to New England Urgent Care Health Talks. After a long and very cold winter, we're very excited to finally be welcoming in spring. Unfortunately though, the springtime is often synonymous with allergies. That's why on today's episode we have the very knowledgeable Dr. Michael Gutman, who's going to be offering his expertise on how to first recognize the allergy, what is an allergy, how to prevent them, and what is the cause. So thank you, Dr. Gutman, and welcome.
Thanks, good to be here again.
So, like you had mentioned on the last issue of New England Urgent Care Health Talks, many of the patients that come to New England Urgent Care Clinic during the winter months have had the flu. Is that similar in the springtime with allergies?
May is one of our busier months. Allergy kicks in, this is the allergy season that kicks in at this time. The trees are pollinating, molds are growing, people are working in their garden, so there are a myriad of reasons why folks will get allergic reactions and are coming to our facilities to avail themselves of our services.
Well, let's not waste any time and actually dive into the topic. So, what exactly is an allergy for starters?
Well, there are several allergy classifications, which I'll get into in a bit, but most simply an allergic reaction is the body reacting in an overly robust way to exposure to a foreign material to the body.
So, in what way does the body react?
Well, the most common allergic reaction is the one affecting the nose. Patients get what physicians call rhinorrhea, but what most people call runny nose. The eyes may become swollen and itchy and red. Other reactions involve the lung, where the small tubules in the lung get narrowed and filled with mucus, which cause bronchoconstriction. This leads to wheezing, difficulty breathing, and this is commonly known as asthma. The skin is affected by getting various types of rashes, but the most common one is characterized by itchy wheals, that's hives. Another skin reaction is to direct contact with the material, resulting in a crusty, weepy kind of rash, as might be seen with poison ivy. Then the cardiovascular system may be affected in a severe allergic reaction, resulting in peripheral blood vessel dilatation and, as a result, dropping the blood pressure to very dangerously low levels. And then the gastrointestinal system may be affected, causing abdominal pain and vomiting. Finally, a rare but nevertheless significant reaction is where the joints become inflamed and painful, and that's due to a reaction usually to medications.
Okay, and are allergies pretty common?
They're downright epidemic is what they are. 10 to 15% of the population in the U.S. is affected by allergies. That translates to between 35 and 40 million people have some form of allergy.
Wow, so what are some things then that cause an allergic reaction?
Well, the pathological responses that I just described, the runny nose and the cough, are due to what we encounter either in the air or what we ingest, or what we come in contact with. Those materials are known as allergens. If it's in the air, often it's from plants, the pollens of the plants, or fungus products, and they release mold spores. Then there's things that we ingest, such as in food or in medication. Then there's also things that we inject, which can be in medication, but a form of injection, if you will, is also wasps and bee stings. Mm-hmm. And then contact materials, most commonly such as plants, poison ivy, sumac, oak, and also metals that are on many forms of jewelry, specifically nickel will give a contact dermatitis.
Oh, it's like a rash, basically.
Yep.
Okay, so then what's the seasonal allergy that seems to be what everyone is getting at this time of the year?
Many patients get allergies only at certain times of the year. In the spring, as I mentioned earlier, is a very busy time for us in New England Urgent Care. There's the grasses and the trees are pollinating, and so the pollen is floating around in the air and causing all the symptoms that we talked about. In the summer months, the fungus and the mold spores that they release are in the air, especially if there's been a wet winter and spring.
Okay.
And then in the fall, many trees again have their last fling with each other and are releasing pollens again. So from late spring to early fall, at least in the Midwest and the Northeast portions of the country, there's an uptick in allergic reactions, usually due to these plants trying to be fruitful and multiplying.
Okay, so what about then the poison ivies, the oak, the sumac? How are they different from the seasonal allergies that you had just mentioned?
Well, I suppose you might say poison ivy, oak, and sumac is seasonal, and it is in the sense that it happens during the growing season. Anytime the patient is exposed during that time, then they will get an allergic reaction, and that usually happens from early spring to late fall. Most seasonal allergies give allergic reactions that involve a runny nose, watery eyes, possibly asthma, even hives. Poison ivy, oak, and sumac give another type of skin reaction called contact dermatitis, which is characterized, as I mentioned earlier, by this crusty, weepy vesicles that can be not only itchy but painful as well.
So then what about those non-seasonal allergies, and how are those different?
Well, aside from the fact that they tend to occur year-round, the only other thing that distinguishes them is that they tend to not be due to inhalation of plant pollens. But the same reactions occur just to materials that are available any time of year, such as animal dander, for example, from dogs, cats, which give similar reactions to when exposed to plant pollens, runny nose, this wheezing. Mold spores can also be produced indoors throughout the year, especially in older buildings. Mm-hmm. Then there are the materials that can be taken by mouth, such as food or medications that cause reactions year-round. There are also materials when they contact the skin can cause reactions such as nickel plating on jewelry and also latex.
So then can someone have allergies, let's say peanuts or jewelry allergy, as well as then seasonal allergies?
Yes, there are patients that have multiple allergies.
So then how does weather then play a factor into these allergies?
Weather tends to affect the likelihood of seasonal allergy severity. If it's a hot, windy day, then trees and grass pollens are being spread and are abundant in the air. That's the high pollen count. So allergy sufferers have greater or more severe reactions. If it's just rained and the pollen counts usually are low, then they tend to not suffer as much. Overall, if it's a wet spring, then there's a higher mold spore count in the summertime. And if it's a wet summer, then there's a higher ragweed pollen count in the early fall.
So people really need to pay attention to kind of the weather patterns and be able to help monitor their allergies.
And that's in many papers they actually report the pollen counts.
Oh, nice. So who is then susceptible to allergies? Is it a hereditary factor?
Well, you bring up an interesting point. There's been a progression or evolution of how what actually causes allergies. Some of the mechanisms of allergy were only, in fact, recently described and discovered back in the early 60s. The IgE, the immune globulin mechanism, was only in the 1960s. At that time, most experts thought that allergy had a lot to do with heredity. In fact, many of the studies have supported that, such as, for instance, identical twins are more likely to share allergic reactions.
By that, then, do you mean that there's too many allergies in our society?
Well, not quite. I don't think there's any more allergens around than there have been before, any more foreign material to the body. A theory that's becoming much more accepted is the hygiene hypothesis.
Okay.
This states that, in fact, it's not enough exposure to all the materials in our environment that's leading to the incidence of allergy. In other words, we live in too sterile an environment. Our developed industrial societies prevent us from being exposed to too many materials, bacteria, and parasites that ultimately become allergens or, in fact, help prevent allergy. Parasites, for instance, it's felt that if you have parasites, you might have decreased allergic reactions because the body, they secrete something that causes immune suppression in the body. Our immune systems don't recognize the foreign material because of their rarity, and so when they do encounter them, there's this overly robust reaction to them. This hypothesis is supported by the fact that folks who grew up in a rural setting or in third world countries are much less likely to have environmental allergies than those who grew up in the city and or developed countries.
Wow, that's actually a very interesting point. People would never really assume that or look into that. But do allergies vary by the age of the patient, as far as maybe a child to an older person then developing it?
Absolutely. In fact, I'm a great example. I had much worse allergies when I was a kid, and I grew out of them. So as kids grow older, they grow out of their allergies, tend to grow out of their allergies. So allergies actually peak before the age of 10. And then between the age of 10 and 30, the incidence falls off. But you can have an allergy throughout your lifespan, especially if it's a life-threatening one. I wouldn't count on your life-threatening bee allergy disappearing at age 45 and not carry around your epinephrine. So in general, kids age 2 to 10 tend to get allergies, if they're going to get allergies. But adults can develop allergies also, even if they did not have them as children. So it's certainly possible to develop an antibiotic allergy to an antibiotic, for instance, as an adult.
So then can allergies be locational, whereas maybe you're traveling or you move throughout your lifetime and then you develop allergies?
Yes, a person may be exposed to a plant and animal that are distinctive to certain locations only. However, as in all allergies, the person has to be exposed to that allergen at least once. What I want to make sure that people understand is you're not going to have an allergic reaction the first time you're exposed to something.
Be second or third.
It has to be a second or third exposure. It takes the first exposure for the body to respond with an overly robust response the second or third time that they encounter it. So you may have a great trip to the southern Florida Keys on your first vacation there, and then the second time you're there, you're having a miserable time because you're sneezing and wheezing because you've developed an allergy to some a plant that pollinates only down there.
Okay, so then how can someone distinguish the difference then from a cold and allergies, because the seasons are so close together and the symptoms seem to run very aligned?
Well, sometimes it's a bit difficult, I must admit, to distinguish clinically, as so many features such as runny nose and even wheezing are characteristic to both colds and allergies. In general, rash and itchy eyes are not part of the constellation of signs and symptoms of a cold. Also, but not always, when patients have a cold as opposed to an allergy, they tend to just feel lousy and they have a low-grade fever. However, this is also seen in some allergy sufferers. They just feel lousy. Sometimes context is the only help. For example, symptoms that tend to come up only after you've played with a cat or you've been outdoor on a windy, hot day, and so then that's probably an allergy as opposed to a cold.
How would someone get tested for allergies?
Allergy testing is usually done by an allergist. These include blood tests and skin tests when a small amount of potential allergen is injected into the skin, and then they see if a reaction to that allergen occurs.
Does everyone who have allergies or think they might have allergies get tested?
Allergy testing is recommended if there's been a life-threatening allergic reaction to an unknown allergen. For instance, I was stung by a wasp when I was a young adult and had a severe reaction, but they weren't sure if it was a wasp or a bee or whatever, and so they tested it to make sure. Or if the allergic reaction is frequent and interferes with your lifestyle and is not responding to the usual measures.
Okay, so what are these usual measures then?
Well, for most allergies, the best treatment is avoidance. So if you have a seasonal allergy on high pollen days, close the windows, turn on your air conditioning, and stay inside. If you're allergic to cats, don't own them or play with them. If you have a medication allergy, avoid anything that's in that medication class, and make sure to tell your physician or any physician that you're about to get treatment from what that allergy is, because sometimes they might give you a medication which is not exactly the same and doesn't sound the same, but is in the same class. For instance, Motrin is in the same class as aspirin. If you've got a severe aspirin allergy, you don't want to be taking Motrin.
So it's good to distinguish and have open communication with your provider.
Absolutely.
So what are the treatments then?
The main treatment for most seasonal allergies is antihistamines, which you can get over the counter. Histamine is something that the body releases and inflames a lot of tissue. The problem is that many people find this treatment inadequate and they don't tolerate the side effects, which is the drowsiness and the dry mouth, and interferes with their life. This is where a visit to primary care physician, or if you can't be seen in a prompt fashion, to our urgent care is worthwhile. We can give other prescribed treatments depending on the severity and length and time suffered from the reaction. Some of these treatments include inhaled or oral steroids, as well as other cell stabilizers that prevent the body from having a reaction to the allergens. In the case of poison ivy, sumac, and oak, we can prescribe either high potency steroids, or if the rash is, and that's if the rash is localized to only a couple of spots. But if it's widespread and severe, then oral steroids would be our prescription.
Now, you had touched on it a little bit earlier, but can allergies then be very life-threatening?
Yes. Exposure to allergens cause what's called an anaphylactic reaction.
Okay.
When this happens, the reaction results in very low blood pressure, swelling shut of the throat, asthma, and generalized body swelling. I mentioned earlier that I had a reaction like that. I was stung right in between my eyes by a wasp, and my face blew up to twice its size, and I got asthma that day.
So obviously that's very, very serious, but for our viewers watching back home, how common is this?
Fortunately, not very common. Only 400 people a year die in the U.S. from an anaphylactic reaction, which works out to about 1 in 75 million deaths a year. But if your family member happens to be the one that is part of that statistic, that rarity is a little solace. So
what is the treatment for an anaphylactic reaction as opposed to, getting a medication or a prescription?
Well, the main treatment is administration of epinephrine, or also known as an adrenaline shot. This is followed by Benadryl, which is the most potent antihistamine available, and you get either oral or IV steroids.
Are certain allergens more life-threatening than others?
Just about anything that causes a non-life-threatening allergic reaction can potentially cause a life-threatening reaction, anaphylactic reaction. However, as I'd mentioned, it's pretty rare. And the most common life-threatening allergy is due to being stung by bees or wasps.
What role is New England Urgent Care playing in treating anaphylactic reactions?
Okay, this is a bit of a tricky question, similar to the one you asked me several months ago when we talked about heart attacks.
Okay.
And whether we should treat heart attacks in New England Urgent Care. The answer lies in how likely is the ambulance, upon being summoned by 911, if you called 911, to arrive at your door sooner with a person who's qualified to treat you than if your loved one can whisk you by car to New England Urgent Care during our hours of operation. Which, incidentally, I should mention our hours of operation, so you don't arrive there after we're closed and have to wait for the ambulance there. We are open 7 days a week, 8 to 8 Monday to Friday, 9 to 6 weekends, and all holidays, so 365 days a year. So if the answer is that the patient can get to our urgent care center faster by private car, then if they call the ambulance, you should come to New England Urgent Care. In most cases, the anaphylactic reaction can be treated definitively in our center as we stock all the current resuscitation drugs such as adrenaline, and we have breathing treatments for the asthma, and we're capable of administering IV fluids for the low blood pressure. We've treated several anaphylactic reactions successfully and definitively in the past. By definitive, I mean that we didn't even have to send them to the emergency department after we'd treated them and monitored them for several hours at our center. The fact that we're equipped properly, as required by our certification, and all our healthcare personnel, including our nurses and providers, are emergency medicine trained and experienced, makes us more capable of dealing with these kinds of situations than clinics who merely have urgent care on their signs but are not certified. We are the only ones in the Farmington Valley, incidentally, who are certified. Finally, once the initial life threat is over, we can prescribe adrenaline. I mentioned EpiPen for the patients. There's other medications that are similar. And then educate them on how and when to use them.
So you guys can really help as long as you can get there first before an emergency vehicle.
So again, the issue is you got to figure out who's going to get there sooner, the car or the ambulance.
Definitely something to consider. Now, is there anything else that can be done then for a bee or a wasp sting or an allergy?
Well, the best and one of the most successful preventative treatments is actually felt to be one of the most successful preventative treatments in Western medicine is getting an allergy shot.
Now, are there some side effects to this allergy shot? Can you get an allergy shot at a place, let's say New England Urgent Care, any urgent care, and walk in?
The worst side effect is actually having an anaphylactic reaction to the allergy shot.
Wow.
The allergy shot works by increasing in greater and greater amounts the allergy over time and desensitizing the body to the offending agent. However, if the patient's body has not become used to the allergen sufficiently, then the serious reaction can occur. This is why allergy shots should be administered by an allergist, so that the short answer is no. Our urgent care center does not give preventative allergy shots.
Now, if someone did not want to take medication, do you have any suggestions on a natural homeopathic allergy medication or remedy?
One very natural way to help stop minor allergic reactions involving runny nose and itchy eyes is to rinse the nasal passages with salt water. The tools and instructions for that are easily received. Go to the drugstore and get a neti pot. It's called neti pot.
Okay.
The latest recommendation is using a European herb called butterbur. There are treatments that some naturopaths are recommending, such as freeze-dried nettles and golden seal. Some of those items, incidentally, can be procured at Ravenwood Natural Health Store in North Simsbury. One natural preventative treatment for seasonal allergies is taking locally grown honey. Locally grown honey is made from plants that have the pollens around here, and so it's sort of like a natural allergy shot, if you will.
Again, you're getting your body
You're desensitizing. Yeah.
Exactly, and there are several farmers areas in Simsbury and around where you can obtain this honey.
Yep.
Are there any similarities, kind of going a little off topic, between allergies and asthma?
Asthma can often be caused by an exposure to the allergen. The treatment for asthma includes inhaled bronchodilators, and similar to allergic reaction, if an asthma attack is severe, it requires adrenaline, steroids to bring it under control. Not to belabor the point, these are treatments that are available at New England Urgent Care, and we can treat that.
So we've gotten a lot of great information and tips today. How could you kind of maybe summarize what are the most important things that we've talked about today on this episode?
The take-home points are that avoidance is the best medicine for allergies. However, we cannot live our lives in an air-conditioned bubble. So if the usual over-the-counter treatments are not effective in combating allergy, then visit to the primary care physician, or if you can't get in a prompt fashion, to New England Urgent Care. And it's worthwhile that the most potent preventive measures can be given. Finally, if you or your loved ones have an anaphylactic reaction, make sure you have an adrenaline shot available at all times and have a rescue plan, which can certainly include New England Urgent Care.
Well, thank you again for being with us, Dr. Gutman. We always appreciate you having on this episode and helping the public become more familiarized with issues in the community and issues in their health. So thank you again for watching. Have a great, healthy spring. I'm Alex Almeida.
And I'm Michael Gutman.
And this is New England Urgent Care Health Talks.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.